I just got back from clinicals and I'm still wearing my green scrubs, and I thought it would be really interesting to show you guys what I carry in my clinical bag versus what I carry in my normal typical school bag. And right now I'm currently in general surgery for my clinical rotation. I just switched over from cardiac. So I'm just going to be showing you guys first what is in my clinical bag. This is what I had in my bag for today, minus my food that I brought for breakfast and lunch, which I also carry in this bag. I'm just starting off in the front pockets of this bag. I have sticky notes. I have it just in case I need to write something down in the morning in case I forget, but usually I do not grab this. Actually just realized I also have a Sharpie in here as well as a pen, and in here I keep my water bottle. I also use the same water bottle for my backpack, but because today was clinicals, I just had it in this bag with me and I just carry this throughout the day. I try to hydrate as much as possible just because it's so easy to not drink enough water when you're on the unit, and I usually just refill in the nourishment room, and I don't really walk off my floor unless I need to or if I decide to take a break. But I just fill up my water bottle in the nourishment, but in the morning I drink my hot water as usual. Not much of a coffee drinker. And I also have my brain sheets. Because it was a U unit, the brain sheet isn't the one that I usually use. My clinical instructor had her own, so I just printed it out and I try to write things down for the patient that I was working with today. And then I also have a blank sheet of paper that I just grabbed from a printer in case I needed it, which I didn't. But I have 3 different types of brains because I wasn't sure which one to use specifically. I didn't like the format that my instructor had it in, so I rearranged it, but it still includes the same things, just different format. I also have my badge with me. Usually I have to have it clipped on in the front when I'm working, but because the shift's over, I usually just put it back into my bag. And then I also have a coconut drink in here. Didn't drink this today, but I have a drink of some sort. And then I have all my essentials in this stethoscope case. And usually I carry my stethoscope in here. I have my classic Littman 3. And I usually keep this in one of my pockets here on my pants, and I also have a pair of scissors. This comes in really handy, surprisingly. I usually use this to cut up any medication packages that are super hard, super difficult to tear apart. I also use this to cut up any bandages or any tape or anything, because sometimes scissors are so difficult to come across. And I also have some pens in here and a pen light. I usually keep this in my front pockets. Use my pen light to assess Perla, and I have pens just to write down notes in my brain or just for myself on a separate sheet of paper. And then I also have a thermometer and thermometer strips, but I just carry it all together because I needed it during my first term of nursing school, but I don't end up using it just because in the patient's room there's usually something that we can measure temperature with already. And then I don't usually carry any goggles with me, but I may or may not, just depending on how it is this week in general surgery. I don't know if I will be experiencing a lot of sputum or liquids being splashed in my face, but in case I do tomorrow, I plan on also having a pair of goggles just to be on the safer side. Let me see. I think these are the goggles that I have. I don't carry this right now. These look so similar to the glasses that I used to have. Maybe I'll actually just throw it in tomorrow because I actually do need it. And then onto my backpack that I usually normally wear for normal school. Usually try to keep my backpacks fairly light just because I don't want to have a lot of back pain later on in life. And in the front pocket here, I usually keep my AirPods just because whenever I get a chance to work at school, I like to use the noise canceling function on this. I also have a pair of earbuds in here just to use for test taking. I like noise cancellation, as you can clearly tell. Then I also have a lock just in case I ever want to put myself away in a locker. And then I also have a loose hair tie in here. Moving on, in this other compartment, I keep my sunglasses in here just because my eyes are very sensitive to light. And now that we are kind of near the middle of February, the sun's starting to come out a little more, and this comes in handy. And I also keep a lot of granola bars and snacks in here. And I have my pencil pouch where I keep pens and pencils and erasers in here. I don't really use this that often, but in case I do, this always comes in handy. I also have a highlighter, and I have a pack of gum, and a lot of receipts and cards in here. And then I also have this where my old badge used to be placed on, which is not that helpful, especially if you're trying to badge into things. I like a retractable badge holder. And then moving on to the center compartment, I keep my planner in here. I usually like to cross things off, write things in here in case specific dates come up, or whenever I finish assignment, it always feels so satisfying just being able to scratch that off. And then in my last compartment, I have my laptop with me. I typically do not bring my laptop with me unless I know I'm going to be working on a class assignment that's due soon and I just need to do some last minute stuff. Otherwise, I actually just keep my iPad with me so that things are lighter. I usually just download the slides that I have for class and I just write over them while lecture happens. And I keep my water bottle in either one of these pockets. And oh yes, last but not least, I have my wallet with me. I usually just keep it in my scrub pocket just because we don't have our own locker. So I put my things in the break room, but then I carry my wallet with me. And I think that is everything that I carry in my clinical bag and in my backpack. This is pretty realistic. Hope this was informative for any of you guys that are going into clinicals or have clinicals or are starting nursing school soon.